What's up, guys? Cade Moore with More Muscle. Today we'll be talking about substance use and addictive disorders, guys. So this includes alcohol, caffeine, cannabis, hallucinogens, inhalants, opioids, stimulants, and tobacco. And this is usually going to cause significant impairment over a 12-month period. These are going to, some risk factors include genetics, family history, chronic stress history, trauma, low self-esteem, lowered tolerance for pain and frustration, few meaningful personal relationships, few life successes, and risk-taking tendencies. So all of those are going to increase your risk for substance abuse disorder. So usually substance abuse is highest at 18 to 25. And the younger the person is, the higher the incidence of developing substance use disorder. So that's interesting. Some commonly used substances are opioids. So this is like heroin, morphine, hydromorphone. These can be injected, smoked, inhaled. This is going to cause a rush of euphoria, like happiness, relief from pain. And then also, you're going to have effects of intoxication, which is slurred speech, impaired memory, pupillary changes, decreased respirations, guys. Remember, decreased respirations. Person's respirations are supposed to be about 12 to 20 per minute. If it's above 20, obviously if they're exercising, it's different. But if it's under 12, you don't want to be taking any opioids because this can cause you not to breathe and you can die from that. So that's one thing with opioids is you want to check your respirations. And there's also a naloxone, which basically is going to cause those receptors for opioids to basically get rid of all the opioids, which is like a miracle drug kind of. But right after you do that, you'll see some withdrawal manifestations, and it's called, you're going to have sweating, runny nose, tremors, irritability, severe weakness, diarrhea, fever, insomnia, pupil dilation, nausea, vomiting, pain in the muscles and bones. The next one is alcohol, guys. Alcohol, you want to have so BAC is blood alcohol concentration level, and 0.08 is considered legally intoxicated, and 0.04 or greater levels is like toxicity, and death can occur. So obviously you want to if you do drink, you don't want to get too high on that level. And it's usually intended for relaxation, decreased social anxiety, and stress reduction. This can cause slurred speech, memory impairment, altered judgment, and it can cause liver damage, guys, fatty liver, or scarring on your liver, which is called cirrhosis. And so you can have hallucinations, illusions. Alcohol withdrawal, delirium can cause 2 to 3 days, and you're gonna have severe hypertension, cardiac dysrhythmias, and delirium. Alcohol withdrawal delirium can progress to death. So then we got like hypnotics, cannabis. The thing with cannabis is like the medical field hasn't really studied it as well as we should have. There's still a lot of unknown things about cannabis. But it's going to cause euphoria, sedation, hallucinations, decrease of nausea. It can increase the risk for lung cancer, respiratory and other respiratory effects. This can cause delusions, paranoia, tachycardia, and it can impair your motor skills for 8 to 12 hours. Cocaine, guys, is a big-time stimulant. This is going to increase your energy. You have dizziness, irritability, tremors, blurred vision, hallucinations, seizures, extreme fever, tachycardia, hypertension, chest pain, possible cardiovascular collapse, and death. So withdrawal, you're going to have some major depression, fatigue, craving, excess sleeping, insomnia, dramatic unpleasant dreams, psychomotor retardation, agitation, not life-threatening, but possible occurrence of suicidal ideation, right? There's amphetamines, inhalants, hallucinogens, that's like LSD. These are all going to cause some very terrible side effects. Caffeine, guys. Caffeine is a major stimulant, and yes, it is a drug. If you have too much of it, it can cause heart problems, tachycardia. So you obviously want to limit that. So anything over 250 milligrams can cause these problems. There's tobacco. And guys, so what I want to get at is there's a lot of medications that can help with these. Like there's alcohol withdrawal medications such as diazepam, carbamazepine, clonidine. There's alcohol abstinence, disulfiram, naltrexone, acamprosate, opioid withdrawal, methadone, clonidine, nicotine withdrawal, bupropion, and nicotine abstinence. These are all going to help. But you want to encourage like a 12-step program. You want to try and stop a relapse from occurring. A lot of people, if they have a hard time they go through, they can come back to a drug. And the interesting thing is, the younger that you start, the more likely you're going to have substance abuse disorder. So yeah, guys, there are some drugs that, like, for example, opioids. You can take naloxone, which can completely help you which can reverse the effects. There's just a lot of these drugs that cause a substance abuse disorder. And I think, from my personal perspective, I've seen a lot of people in rehab with, substance abuse disorder, quite a few actually, and I'm seeing younger people in the rehab setting with substance use disorder, where basically they're in, they have so much fear because they've just been using drugs their whole life, and they don't know how to really handle their mental health without those drugs. And I've seen it. And the thing with drugs is it's going to increase your risk for schizophrenia, mental health issues, heart problems, and it's going to increase your risk for depression because basically your happy hormones, like dopamine, they're going to be, basically, if you say, for example, if you take cocaine or some type of drug, your dopamine is going to go through the roof, and when you come down, that dopamine is going to be messed up. Off that high, your dopamine is going to be messed up. You're going to feel amazing for a couple hours or whatever it is, but it's going to come down. So guys, what my recommendation is, you got to find outlets, right? So if you're having a stressful day, you got to find something you like. You got to find, the gym. You got to find something that you enjoy, that you can put your time towards instead of, taking a drug, because these things have harmful effects mentally, physically, and they'll hook you. They'll take your money, and what I've seen is a lot of people with drug, substance abuse disorder. The only thing they care about is getting more of that drug. They don't care about other people. They don't care about their family. The only thing they truthfully care about is getting more of that drug. I've seen people like that, and that's sad because they have no life, and it's just sad. But the best thing, guys, is just don't start in the first place. It's a million times easier not to ever take a drug in the first place, because once you get a taste of that, you're always going to have a hunger for that drug. If you never know what it tastes like, you'll never have a hunger for that drug. Another thing is, guys, like, even caffeine, guys. Caffeine is so used by everyone, basically. But caffeine is a stimulant drug, guys. Too much of it can be very harmful. You want to be careful with pre-workouts. You want to be careful with coffee. I never drinking coffee, and the reason is, and some people might think I'm weird that I don't drink coffee, but the reason is because I've seen people, when they stop drinking coffee, they can't function. Guys, you're not supposed to be hooked to things like that. If you can't focus without coffee, then there's something wrong. You got to be able to focus, with whole foods, eating healthy and whatnot. But guys, there are some drugs like naloxone that can help with opioids, but then there's other drugs that have no reversal agent, like alcohol. There's a drug called flumanazole, and that's going to help you reverse the alcohol. But for the most part, these drugs are, they're going to hook you, And some of these drugs don't have any reversal agents, and they can be very serious for your health. So my thing is, if you're 16 years old and you're listening to this, just never go down that path. Even if your friends are going down it, never go down it, because it's going to save you tons of time. It's going to make you so much happier in the long run, and you're going to be able to make wiser choices. So thanks for watching, guys. Subscribe.